have the other side of the lifestyle.
Thank you. Yeah, so that's a valid question. Sometimes, I have to work late into the night.
That is so key. Yes, like 12, 11. Inevitable to okay. Some people say, oh, weekends, let them be able to finish those hours. If they can take a little, it goes. They can take a little bit of night shift. All this night that actually negative. We know the cause that because your other thing is food factor. People eat during the day hormone anymore. Which is supposed to go down when you're awake, when you're longer, the ghrelin wide awake. So during the day, it's accumulated. It recommends that night shift because regulating disrupted, so your blood sugar is not. So what's it is? Because so if you can avoid it, because night shift or more colorectal cancer. That is to avoid risk of having some healthy lifestyle. After when you go to bed, prepare your mind when you're sleeping during the day. It's not always easy during the day to sleep, but let other people already slept at night, but they are still disturbing you. You are still doing childcare. You won't be able to sleep, so you need to create time for yourself because it helps you in the long run.
Thank you very much. So the goal of today's discussion is to kind of get us aware of the dangers of missing quality sleep. We all have had to be awake at night trying to catch up on things. Sometimes, yes, I'm in the hospital 12 midnight. But again, we have to make room, intentionally make room, to compensate. And as Dr. Ogunde said, there are studies that, yes, staying awake at night, working night shift, is a problem to health. So we have to make time to compensate. When you come back, make sure everywhere is dark. You're getting as much sleep as possible for your own good. Yeah, these are scientific studies, and we just have to be a little more careful, even with ourselves and our kids doing this. And that's the purpose, just for awareness. That's why we're doing this. Any other questions? Yes.
Praise the Lord. Thank you all for the teaching. I just have I'm a bit curious. Dr. Ogunde, you mentioned in the course of your talk, you talked about for when you train your body to sleep, there are some sensors, if I'm correct. You talked about some sensory glands that regulates during the day or when it's getting dark, Based on the question that she asked, I'm trying to balance it in my head. What happens to that sensors when you work night shift? Because you can't sleep in the night, so will the sensors be confused or something, or will the sensors really?
Yes, it get confused. So there is an imbalance because it's supposed to be like, okay, this is nighttime. Your body is supposed to shut down. I don't need all these hormones to wake up, but you are awake, so it confuses your body. There is an imbalance of those hormones. So, and that's why we has increased risk for some of these problems.
So, but you have to continue working
But you have to, so
So
that's
what
where you have to kind of train your body to adjust to the new normal. Yeah. So that okay now this, even though it's not good, you still need to work with your employee to not do consistent long nights. But you train your body to kind of like try to replicate what you do on that. That's why you should avoid eating, because your body is supposed to know that you are supposed to be sleeping, not waking up, not awake. So train your body to simulate what would happen in a regular person, so that your immune system is not all over the place. That okay, what am I supposed to be doing now? Like yes, that's exactly what you do. Just train your body.
Thank you.
Takes time.
You want to weigh in on that one?
Yes. So, like she said, not eating at night, and I know people chuckled because how are you supposed to stay awake? There's certain foods that are probably better to eat at night, like not carb loading yourself. So things that would cause you to need insulin and all these other things that should be asleep at night. So yes, we drink coffee or whatever to stay awake. Sure, liquids to try and keep yourself awake are okay, but try to stay away from heavier foods because that's part of the problem, right? When we're awake, we're eating the heavier foods, but our body is able to manage that. When we should be sleeping and we're eating heavier foods, that's confusing our body. So try to more liquids, and then less carb heavy foods are another thing. And then also totally agree with trying not to do multiple night shifts in a row. Like maybe it pays more or all this other stuff. It's not a good idea for all the things that she said. And then also you're not getting sunlight, which is a big deal. Like if you're working at night, you're not getting vitamin D or the processes that are needed with sunlight to make vitamin D and calcium, which your body needs for bone and growth and other growth processes. So it's a really big deal to try and like at least get out when you're awake or when you get back home. Sure, you need to sleep, you need to recuperate, but you need to be outside and like get other things to help your body try and stay on rhythm as much as possible. I know this is hard. I know real life comes in the way, but these are the things we're trying to bring up so we can balance it out as much as possible.
Yeah, thank you very, very much. Another question over there?
Yeah, thank you so much. Being a night nurse for over 25 years, I've trained my body. It's not normal, but what keeps us going during the night is usually coffee. We try not to eat much, but then we experience caffeine withdrawal. What do you think can help? And I wish people wouldn't call us night nurses during like 2 p.m. because that's when we're sleeping. I'm like, I'll call you at 2 a.m. too, so you can feel it.
So,
that's a tough one, because one way or the other you need to stay awake, but you kind of have to balance things. And of course, the way to balance this is like, yes, you have to prioritize yourself. Yeah, don't take those, because those caffeine to stays awake doesn't allow you to like really be super efficient, but you still need it. So it's about prioritizing what is important. And your time when you are off duty, maximize it. Let people know that this is your time you need to sleep, because yes, we know we have a personal life, we have a relationship life that we need to meet, but let them know why you guys are sleeping and working. So prioritize and like cherish those opportunities that you need to sleep. Your off day, that should not be the day you should go about shopping. It's difficult to not do that. But those weekends that you are not working and all of that, don't take too much caffeine, but I don't know, you still have to work. So it is tough, but prioritize your sleep when you are not working or during the day. Dim the room, do all of that. Let people know that between this time and this time, please let me have some peace and quietness.
yeah, that's very important. Thank you very much. Do I see a hand over there?
Just in case someone on the panel knows, when does waking up frequently at night become a problem? Or are there things that we can do to help with that?
Yeah, waking multiple times at night is a problem. It's always a problem, but there may be so many things that can play a role in it. You may have some medical condition. Some people have maybe bladder issue that they have to wake up, so many things. So it can be both. It can be your waking up may not be because you want to wake up.
Sleep
because
apnea.
there may be some
Sleep apnea.
sleep apnea,
Restless
insomnia,
leg
restless
syndrome.
leg syndrome. So you may need to figure out the cause of that because ideally you should be sleeping. So you need to like rule out some medical condition that may be a triggering factor for you to wake up. So you need to see a doctor to rule out are you too fast, sleep apnea, insomnia, restlessness. So many factors can play a role. Depression too.
Definitely. That's really it. And because there are medications, I know we don't like to talk about it, but sometimes you need medications to help. Melatonin, which is over the counter, it's basically the I can't think of it. It's the generated version of the natural occurring substance in your body. You can use that to help you fall asleep. It helps you fall asleep. It doesn't keep you asleep. Other medications that would keep you asleep are sometimes habit forming, so watch out for that. But there are medications that can help with these issues if there's not a medical basis that will help fix it. So just, go to your medical provider and figure it out. Like, it's for your best interest.
Yeah. Thank you very much. So if you're not sleeping, if you're waking up multiple times, there's usually a reason because your body really wants you to sleep. The commonest one that is not recognized, especially in African communities, is obstructive sleep apnea. Yeah, like if you have a family that snores, that's a sign. It doesn't mean that they have the disease, but it's a sign. Obesity, and they snore a lot. The snoring is about the structures of the throat relaxing, in other words, collapsing to sleep, and therefore blocking the airway. So, it will affect sleep. So there's a remedy for that. If you have a family member that snores a lot, it's very likely not getting good sleep. And they can see the doctor, so they can work on sleep study to get them a sleeping machine. We call it CPAP. So that way they can have a restful sleep. I've seen people that went on the CPAP machine and their blood pressure came down. They started losing weight. The diabetes got under control. In other words, lack of sleep was what was driving all of this. Irregular heartbeat. So a lot of things get better. So that's one thing that is usually overlooked. Snoring is not a good thing. It interrupts sleep. So at this time, we want to bring it to a close based on our time. And I want to thank my able and professional panel, Dr. Ogunde, for helping us out, as well as Dr. Yebade. Thank you very much. Thanks for your time. Thank you for your expertise. And thank you for your professionality. And for myself, thank you so much for listening. I hope you gained something today.